COS. So if you are interested, pay attention. It is a band 3 position. I will be drawing my supporting document from the job descriptions they post here. It doesn't have person specification document on this place, so I'll be using the job descriptions to draw my supporting document. So if you are interested, pay attention. Now I'll be taking a screenshot of what my main duties and key responsibilities are. That is what I'm taking the screenshot from, because that is where I will write my supporting document from, my responsibilities and what I should be doing. Okay, yeah. So this is Sure and NHS Trust. Yeah. So let's get started. From this point, you will find out that they did not state anywhere here that they are offering sponsorship. They didn't state it, but you will find it if you download all those documents they put there. Now, if you have registered with them, this is what your platform should look like. And here, I'm just trying to tell you, show you where you will write that supporting document I'm talking about. Okay, so this is where supporting information will come in. Now let's get started on this box here. So let's get started. Yeah, for this nursing assistant role, I would be using patient instead of resident. Now, if you are applying from care home to hospital, at least you should be using resident. When you want to give an example, because you are coming from the care home. So I'll be using patient because this is NHS job vacancy in NHS side. So I will be using patient. So be smart enough to know when to replace that patient with resident or client. Okay, so I go. This is how I will write the supporting document if I am applying for this nursing assistant role. I am excited to apply for the nursing assistant role in your esteemed trust. I am dedicated healthcare professional with 2 years of experience in a similar role. I am confident that my skills and passion for providing exceptional patient care makes me an ideal candidate for this position. Next one. In my current position in my place of work, I have gained valuable experience working with team members to ensure efficient and effective care delivery. I closely monitor patients I closely monitor patient conditions and promptly update registered nurses of any changes or prompt action. For example, in my place of work, I've noticed a sudden drop in a patient blood pressure and immediately informed the supervising nurse, and this led to quick and timely intervention. I maintain strict confidentiality throughout all communication and demonstrate sensitivity when discussing patient information. My excellent communication skills, both verbal and non-verbal, enables me to build rapport with my patients, their relatives, and my colleagues at work. I take time to understand my patients' needs and concerns, offering them reassurance and empathy in challenging situations. For example, I comforted a distressed patient by listening attentively to their concerns and providing clear explanation about their treatment plan. I also reassure them the best quality of care. I am well versed in accurate record keeping. I collaborate effectively with multidisciplinary team, ensuring a seamless flow of communication within the department. For example, when I was working with a physiotherapist, I ensured that they were fully informed of the patient progress and any relevant updates. I always make sure I give them feedback concerning every patient. As an ambassador of the organization, I act as a role model and consistently demonstrate professionalism. I actively engage in continuous learning, staying up to date on local policies and incentives such as fall prevention, pressure ulcer prevention, infection control, waste management, disposal, you know, you can add more. I have experience monitoring new team members, shadowing new staff, sharing knowledge and supporting them in delivering high quality care. In addition, I am skilled in performing various clinical observation and assessment such as vital signs, blood pressure monitoring, bladder scan, whatever clinical skill you have, you add it. I accurately record and report findings to the supervising nurses without causing any panic, ensuring that any concerns are promptly what addressed. For example, I identified an abnormal ECG reading and immediately notified the nurse in charge. This resulted to timely what intervention. I am excited that the prospect of joining your team and contributing my and experience and dedication to patient care. Thank you for considering my applications. You know, um, you have to do plus and minus. I cannot give you everything 100% because our experiences are different. But this is just like a general something. I drafted it. Feel free to copy it out. Do necessary modifications. You already have everything there. Do necessary modifications. This thing is for nursing assistant role. Most nursing assistant role will have similar job descriptions. It's possible they will have similar person specification, whatever they need. All you need to do now is to, if you when you have now you have this one, modify. Once you get another job, go through the job description. Now, remember this thing I wrote, I got it from the job description. See, and responsibilities. You see what they put there? They said liaise with members of the team within the ward and the department to ensure care is delivered to the patient effectively and efficiently. I said something about that, working as a team with my colleagues. um Update registered staff in timely manner of any deterioration of the patient clinical condition. You saw me, I made mention of that where I said I noticed something and immediately I informed the nurse in charge. All these things, taking them one after the other and making sure you are not repeating them, like you are not just copying and pasting copy. Yeah, this thing act as your guideline, but you are writing it in a more practical term, stating like the way you are doing it or the way you have experienced people doing it. Just modify. Don't go there and put everything the way I just put it out now and copy it. And no, how many years of experience do you have? You can put it there. It cannot be, it must not be two. If you don't have up to two, at least put one. If you have up to two, put two or three or four or five, depending on how many this thing you've got. So let this serve as a guideline for other applications you will do for nursing assistant position. Okay, so the next video I will make will be on application for clinical support worker. Application for clinical support worker, how to write the supporting document. So this one now is for nursing assistant role. And please feel free to apply for this job. It is on the NHS site now, track job. It's still ongoing and they offer sponsorship. I will drop the link as well. But with what I've shown you so far, you can just go on that place and check for, click on nursing and midwifery, band 3. It will bring out, this one is in Surrey. Surrey and Sussex Healthcare NHS Trust. Okay, all the best.